A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
We put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
Welcome to the Therapy Hour. I'm your host, Rusty Lozano. Getting a little bit of lag back here. Thank you for joining us. If you're just following our show, this is a program that actually talks about bringing in professionals from around the Metroplex, and we identify different topics. We actually have great professionals from around the Metroplex. And the objective of this show is to bring resources to the community so that we can actually have people learn a little bit more about where to go and if they have questions. So one of the things that we do is from time to time we actually take live phone calls. We're going to open up the phone lines for our topic today. We have Steve Herzog. He's the medical director, Comprehensive Headache Institute at Texas Neurology. And the phone-in is 214-787-1190. Okay. So I was getting a little bit of feedback. I'm going to turn the sounds down. Today our topic is headaches, headache pain in general, and then we're going to actually distinguish what a migraine headache is. So there's a distinct difference, and we were having a conversation about this. Good morning, Steve. Thank you for being on the show, by the way.
My pleasure.
Good to have you. But we were talking about the distinction between headaches and then migraines. So we're going to actually we're going to discuss that today. But let me set up our topic. So a headache is a pain in any region of the head. Headaches may occur on one or both sides of the head, be isolated to a certain location, and radiate across the head from one point or have a vice-like quality. A headache may appear as a sharp pain, a throbbing sensation, or a dull ache. Headaches can develop gradually or suddenly and may last from less than an hour to several days. And then it goes into causes. I'm getting this from the Mayo Clinic, but what I do want to do is actually open up this topic to Dr. Herzog. And Dr. Herzog, tell us a little bit about a headache and a summation of what a headache is, and according to like what this has said, what can you add to that?
Well, thank you, Rusty. I think it's important to understand that the word headache really is talking about a symptom, and what we treat in the office are headache disorders. There are various headache disorders where headache is a symptom of the disorder. So there are 3 major types of headaches that we see, or headache disorders. There's the most common, which is tension headache. Probably 95% of the population has experienced a tension headache. Tension headaches tend to be mild, rarely moderate, and almost never severe. They tend to be kind of all over the head, and most patients take care of those headache disorders by themselves. And then, of course, the migraine headache is what we see mostly in the office. And then there's a less common disorder called cluster headache. But by far, migraine headache is the most common disorder that we would see in the office affecting about 35 to 50 million people in the country.
Wow. So, in your experience, what causes a headache?
Well, you have to separate the cause from the trigger. The cause of headache disorders depends on the headache disorder. In the case of migraine, we think that there's a chemical neurotransmitter inflammatory problem in the brain that's genetic. In the case of tension headache, it's assumed that maybe it's anxiety, stress, muscle tension in the neck or back of the head. So the cause is the underlying changes in the brain that are occurring, and then they're triggered by various internal and external factors. But you really can't trigger if you're not triggerable. It's kind of like we use asthma as an analogy. A person may have asthma, and they may be triggered by a cat or a dog or allergy. But if they don't have asthma, a person doesn't have asthma, then a cat, a dog, or allergy isn't going to bring on an asthma attack. So to bring on a headache in a person with a headache disorder, you have to have the underlying triggerability, and that's the cause of the disorders. And this is what's going on in the brain that's different in someone that has frequent headaches.
So a thought just kind of popped into my head. At Six Flags, they have this roller coaster called the Texas Giant. And I was actually, there was a time when I was a little bit more flexible, but I remember I actually got onto this ride with my child, and halfway through, my headache started to throb. What do you think that was actually? What would be a trigger for something like that? Just out of curiosity.
Well, that headache probably would have been triggered by the rapid acceleration and deceleration and movement that was occurring in your neck and your scalp. Now, that could occur in almost anyone, depending on how violent the movements are. And as we know, the Texas Giant can be quite a wild ride. The person who would then have a headache that would last long after being on the ride would have a headache disorder. So anyone could get the tensiony or the muscle contraction or the cervical headache coming from the neck, and that may have been what was going on.
I see. So a lot of times people, when they end up getting headaches, and we're talking about triggers here primarily, there may not actually be, it may not be as evident. Like here I was in a situation where my body's being thrashed around, and of course I'm holding my breath a lot. But there are circumstances, I assume, that maybe people they can't really relate or identify what exactly happened.
That's a great point. Triggers can be major triggers, and if we're talking about someone with migraine headaches, an example of a major trigger might be a woman's menstrual cycle. The majority of the time during the menstrual cycle, that particular woman may have a headache. Not that all women have headaches during menstrual cycle, but a woman with migraine as a disorder may say, well, the majority of time, if it's my menstrual cycle, I'll probably get a headache. We call that a major trigger. Another example of a major trigger might be, say, red wine. A person might say, every time I drink a glass of red wine, I'll get a headache. If I don't drink the red wine, it's very uncommon for me to have a headache. But your example is very important because a lot of patients that we see don't know their major triggers. And their minor triggers can be variable from day to day. So something that might provoke a headache today in combination with other triggers might not provoke a headache tomorrow or next day or next week. Example might be something like chocolate. If it was a person's menstrual cycle and they had been stressed and they hadn't slept well and they were dehydrated and they had chocolate, you add all those triggers together, minor and major, and it brings on a very severe attack.
So it's interesting you're mentioning two things, wine and chocolate. So I'm thinking tannins in wine, right, would be a chemical trigger. And what would it be in chocolate?
That's pretty tough because there are so many chemicals in chocolate. It could be one trigger for a particular patient, and again, it could be multiple triggers. So a lot of people say, well, do my allergies trigger headache? And I always remind patients, you can have allergies, and what you're allergic to doesn't bring on a headache. You can have something that some people are allergic to that in you're not allergic to that in you brings on a headache. And then, of course, something that you're not allergic to may not bring on a headache or cause a problem with allergy, but it could cause allergies in other people. So just because someone's allergic to something doesn't mean it's going to bring on a headache.
Right. And I'm thinking, I think of like for allergies, when you're sick and you're congested, that maybe you're getting a lot of this, a lot of pressure in the sinus cavities and when you sneeze and whatnot.
That's true. Sinus headaches are not rare, but usually associated with a cold or a flu when you've actually got infected and inflamed mucus. Okay. 80% of people with sinus headaches don't have sinus headaches.
So would an allergic reaction or an allergy headache kind of work the same as a sinus headache?
An allergy headache could be associated with a true sinus headache, but if you don't have green or yellow or infected mucus that you're able to really blow out one way or the other or bring in, it's not true sinus headache. Migraine can mimic a sinus headache. As a matter of fact, 80% of people that have sinus headaches probably don't. They've misdiagnosed themselves or they've been misdiagnosed by their medical provider, because a migraine that's triggered by allergy, as you're talking about, allergens in the environment or something you're allergic to in the house, could give you symptoms very similar to a sinus headache with pressure in the sinus area, even a little bit of clear discharge, red watery eyes, but it not be a true sinus headache. It'd be what we would call a sinus migraine. And it would be treated the same way you treat a migraine, not necessarily an allergy.
And you know what I'd like to do is get into primary types of headaches, and we're coming up on a break, though. I want to introduce my guest, just reintroduce him. Steve Herzog, he's medical director, Comprehensive Headache Institute at Texas Neurology. And our phone lines, we're going to open up the phone lines today. It's 214-787-1190. We're going to take a quick break, and when I come back, we're going to patch in my friend Chris Jordan, and we'll be right back after these messages.
Do you hear these My Computer ads and think, yeah, that sounds great, but I don't know the first thing about computers? Well, that's okay. Many of their graduates could do little more than turn their computer on and off when they started classes. Now, they're IT professionals. It's not rocket science. It's My Computer Career. See if IT is right for you. Go to mycomputercareer.edu and take the free career evaluation today. My Computer Career is where you get trained for the high-demand field of information technology and start your new life in as little as 3 to 4 months. Attend classes on campus or live online just twice a week to get what you'll need to start your new career. More than just a school, My Computer Career helps you get into the industry by working with hundreds of employers that hire their students. Financial aid is available to those who qualify, including the GI Bill. Classes start very soon, so take that career evaluation now at mycomputercareer.edu.
The law offices of Frankel, they started their practice about 24 years ago. They can get you to a doctor and get you treatment even if you don't have health insurance, and they don't get paid unless you get paid, so you got no out-of-pocket costs. Frankel will take cases to trial when needed. That's why they have a team of trial attorneys. They'll fight and attempt to get you the most for your settlement, and I've referred friends to the Frankels before because I trust them. Partners Mark Frankel, Scott Frankel, and Jean Burkett were all recognized in 2015 and 2016 as Best Lawyers in D Magazine. Mark and Scott were selected Super Lawyers in 2015 and 16. Thomson Reuters Service printed in Texas Monthly. So whether it's car wreck, motorcycle wreck, or 18-wheeler wrecks, the Frankels can help. They make it easy. You can call and talk to an attorney, and the consultation, that's free. 1-800-LAWYERS. It's the law offices of Frankel & Frankel. Their principal office is in Dallas, Texas.
Call 1-800-LAWYERS for personal injury cases. Frankel & Frankel, proud supporters of the Russ Martin Show Listeners Foundation.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello. We are back. We're visiting with Dr. Steve Herzog. He's the medical director of the Comprehensive Headache Institute at Texas Neurology in Dallas, Texas. And I'm going to plug in one of my colleagues, Chris Jordan. Chris, are you there?
Yes, I sure am. How are you doing today?
All right. Great, man. Thank you. Hey, system sounds great, by the way. Chris helped me get some things all connected up yesterday at the studio, and real quick, lickety-split. But thank you. So we discussed migraine headaches and tension headaches, but what's another type of primary headache? So we're discussing primary headaches. Which ones are the ones that most commonly a physician would see or you would seek out treatment for? So we discussed migraine and tension, and is there another one?
Well, the cluster headache is another headache disorder that'd be considered a primary headache disorder. It's less common than tension headache and migraine headache disorders. More commonly, you'd see that in a male. probably 3 to 2 ratio from males to females. Typically occurs in a person when they're in their 20s or 30s. It comes in clusters where it can occur from 1 to 8 times a day, the attacks, and they can last 45 minutes on to a couple of hours. They are very severe at onset. They're very difficult to treat.
I was going to say, are those are probably one of the most defiant types of headaches.
It is, and a lot of patients with cluster headache will say that it's it's the worst pain that they've ever experienced.
Is that really the telltale? Is that an individual who has clusters will have these several attacks or several spats of? Is it an on-off episode?
It's an on-off. So the cluster may come on for no particular reason, and once it begins, the attacks, as I said, can be 1 to 8 times a day. And then the cluster can shut off, after 10 to 12 weeks, and the patient might be headache-free for a year or two.
Interesting. And those actually all manifest through vascular, or is it combination type? Or
it's a combination. The blood vessels are involved, but it isn't primarily a vascular disorder. It's the way we used to think of headache disorders, that they were vascular, that migraine and cluster headache disorders was a vascular disease. We now know it's probably a neurochemical neurotransmitter disease.
Interesting. Really interesting. What is a secondary headache?
The primary headache disorders are where the headaches are caused by underlying processes in the brain or the neck. And a secondary headache disorder, it's something else that's bringing on the headache, such as a tumor or a stroke or an infection or trauma to the head. And the headache is secondary to the other problem.
The other pathology. Okay, I get it. So if there's some sort of injury there, or stroke, or some reason why, some etiology, it's secondary.
Yes.
Do people develop headaches? Let's say that an individual's been headache-free their entire life and never experienced them. Is there a sudden onset, or is there something that can actually make an individual a headache sufferer?
There are a number of factors, although if a patient's been headache-free their entire life and there's a new onset headache, that always raises a red flag for a physician, and an evaluation should take place at that point. If a patient's had headaches their whole life, it's less likely that they'd need any kind of CAT scan or MRI. But if a patient has new onset headache, they've had the new onset of the worst headache of their life, if they've had headache that is associated with fever or stiff neck, headache that's associated with significant visual changes, if those kind of changes are occurring, especially if a person's over 50, then that should be a red flag to seek attention with your physician or to an emergency room.
Yeah, don't try to maybe just always take the over-the-counter, but maybe really seek out, get some eyes on it, and maybe find out a little bit more about what's going on.
Exactly.
So over the break, Zach contacted me and said that we had a caller that had a question for you that is going to it's in our next segment, which is treatments. So, hi, welcome to the Therapy Hour. Did you have a question for us?
Yeah, hi, thanks for the show and the topic.
Sure.
My question is in relation to over-the-counter medication versus when you should go see a specialist to get stronger medication. And I guess the second part to that question is, when is too much medication?
Well, that's a great question. Remember that a number of over-the-counter medications were prescriptions. Ibuprofen and naproxen. Ibuprofen, of course, most commonly known as Motrin, and naproxen, commonly over-the-counter known as Aleve, were by prescription for years until they were used so commonly and felt to be relatively safe that over-the-counter use was allowed. Now, if you'll notice, when you hear the commercials, people talk about the commercial talks about non-prescription strength. So, of course, the doses were dropped by 50% in general when they were sold over the counter. It's not that they're stronger or weaker depending on the brand you're using. It's that what's more appropriate for your headache disorder. Now, there are some prescriptions that are more appropriate for certain headache disorders. So it's always important to discuss with your medical provider exactly what type of headache you're treating, because an over-the-counter medication may be appropriate and a prescription may be appropriate, or a combination may be appropriate. So you really can't say, one is better than the other or one is stronger than the other. These medications are different. In the future, we might have several of the medications we have now that are by prescription only would also become over-the-counter. Now, when to seek attention from your physician? If you're having frequent headaches, if they're associated with various neurological symptoms, such as numbness or tingling, loss of vision, dizziness, lightheadedness, if you're having trouble getting them under control with an over-the-counter medication, or if you're having side effects from the over-the-counter medication, I think that's when you'd want to think about talking to your physician or your medical provider.
Excellent. Do you have any other questions?
No, that's really, I appreciate it, guys. Again, thanks for the show and topic.
Thanks for calling in. So it's interesting. I didn't know that a lot of these over-the-counters they used to be prescription meds. So what happens, I guess, is it more of an antiquated medication, or what is it that would make it
It's not that it's antiquated. I think it comes down to how often they're used, and I don't know the politics behind it, but I suspect the pharmaceutical companies, especially once a medication is generic, if it's shown to be relatively safe, that it could move to an over-the-counter use. Ibuprofen and naproxen are generally safe medications, but you need to discuss with your medical provider if they're appropriate, because it may not be appropriate in certain situations just to go to the pharmacy and grab an over-the-counter medication if you haven't defined what type of headache disorder you have or why you're having a headache.
So I remember growing up and watching television. There were always these Bayer aspirin commercials on television, and they really were directing their attention towards headaches. Is Bayer still used a lot, aspirin?
Well, aspirin is a very common drug. It's been around for over 100 years. It's appropriate in certain situations. It has side effects that can be quite bothersome in terms of GI side effects with stomach upset. And, of course, it can also thin your blood. The newer versions of what are called the non-steroidal anti-inflammatory agents were thought to be safer and often have less side effect. It isn't necessarily true, though, in a given patient. Some people still use aspirin, and aspirin can be very effective if used properly.
Fascinating stuff. My wife takes a lot of acetaminophen.
Acetaminophen is Tylenol, and it is a medication which is a pain medication, as are the non-steroidal anti-inflammatory agents. Yeah. And it can reduce fever, but Tylenol products are not anti-inflammatory. And when we're talking about headache disorder specifically, often inflammation is also part of the problem, which is why the non-steroidal anti-inflammatory agents may be better. But that's not to say that a Tylenol product may be very helpful for a patient that has a tension headache or another type of headache that doesn't require an anti-inflammatory. And then there are medications that combine the anti-inflammatories and the Tylenol products, such as the brand name Excedrin, which is Tylenol, aspirin, and caffeine, which can be very effective for some patients.
So, and when somebody seeks treatment, and now that we're on the topic of medication, so when a physician is working with a patient on migraines, how does that process work? You come in and you would assess them, and they would try out the medications. Is this an ongoing thing? Does it change over time? What is the objective when somebody seeks treatment with a physician?
First of all, Rusty, we need to identify, as we talked about, the headache disorder and make sure that we've got a proper diagnosis, and that really comes from a comprehensive history. Okay. With an addition of an examination, and then whether or not any diagnostic studies are appropriate, they might be done as well. But once we've identified the headache disorder, say, as you mentioned, that the patient may have migraine, it depends on the frequency and severity, the location, the quality, the timing, the onset, the modifying factors. So there are all kinds of things that are involved in coming up with a treatment plan. Because there are different kind of patients with migraine. We call a migraine patient a migraineur, French name for probably people with migraine. And a migraineur on one end of the spectrum may have only one or two headaches a month, and on the other end of the spectrum, which we call chronic migraine, they may have a headache almost every day. So the treatment may depend on a number of things. But what we try to do is we always try to start out with a patient once we've confirmed the diagnosis, and talk about the foundation of treatment, which is a natural approach.
Yeah.
Without a natural approach, the medicines become almost worthless.
So it's almost like a team approach. You look at some other some other types of therapies? Is that what you're kind of?
Absolutely. We start with dietary changes.
So staying away from chocolate.
Well, chocolate,
wines.
it may be if that's one of your triggers. It isn't a trigger in everybody, but if it is a trigger, definitely we want to try to eliminate triggers that one can eliminate. But sometimes we can't eliminate, a difficult job or a difficult time in one's life. We can't eliminate, what may be going on financially. So we look at the foundation of treatment from an exercise, dietary point of view, hydration, proper sleep and rest, stress-reducing techniques, and all of that we have the patient identify those things that they can actually do within the limitations of their lifestyle to try to improve their headache threshold and decrease their triggerability. Then we move on to medications.
So, and we're coming up on a break, but real quick, what about some of the seasonings that we use in foods?
Well, one of the problems is artificial flavorings and artificial sweeteners. They can often be a trigger in patients who are sensitive. So, a paleo diet for most of our migraine patients, or what we would call a more natural diet, is really the foundation of their dietary change. That's important.
Hold that thought. We're going to take a quick break, but I do want to talk about like the artificial sweeteners and some things that could actually be a trigger. I'll be right back.
Credit card debt is like quicksand. Once you fall into it, it's almost impossible to get out. That's because once they've trapped you, the credit card companies keep sucking you deeper into debt with outrageous interest rates and fees. But now you can pull yourself out of debt just by reaching for your phone and calling Credit Associates. If you owe $5,000 or more on your credit cards and you can't afford to pay off your debt, you don't have to. Let us settle your debt for a fraction of what you owe. We'll even show you how much you could save. For free information, call 1-800-900-0664. You can get completely free from debt faster than you ever imagined, without debt consolidation or bankruptcy. We depend on your success and offer a guarantee. You've got nothing to lose but your debt. So reach for your phone and pull yourself out of debt with this life-changing free information from Credit Associates. 1-800-900-0664. That's 1-800-900-0664.
The Ford Summer Sales Event is in full swing.
The kids are not listening to me.
I got this. Who wants ice cream?
Oh, so that's how you get them to listen.
With available powerful third-row seats in the Ford Explorer, there's always more room for the whole family. And then some.
Impressive, huh?
No, not really.
Wait, who are the two in the third row?
Take on summer right with Ford, America's best-selling brand, during the Ford Summer Sales Event.
It's always a good time.
Now with summer's hottest offer. Get 0% financing for 72 months on select Fusion, Escape, Mustang, and Explorer models. Plus get $1,000 on top of your trade-in. Offer ends July 31st. Not all buyers qualify for Ford credit financing. 72 months at $1,389 per month for $1,000 finance regardless of down payment. Trade-Assist cash requires trade-in of 95 or newer vehicle or lease terminated 30 days prior to or 90 days after new retail delivery. Not available on Mustang Shelby, GT350, GT350R. See dealer or go to buyfordnow.com for complete details. Take new retail delivery from dealer stock by July 31st, 2017.
If you experience aha in your hips or knees, take our hip and knee assessment and get back to experiencing Texas Health, the health system more people choose for joint health in North Texas. Visit yourjointhealth.com today.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Thank you for joining us. We're back from the break. If you're just joining us, we have Steve Herzog. He's the medical director of the Comprehensive Headache Institute at Texas Neurology in Dallas, Texas. And before we left, we actually started talking about, we got into some treatments and medications, but then we started talking about triggers. And we just had a really interesting conversation over the break about the different types of foods that might have some potential triggering chemicals in it. Let's see if we can recreate that conversation again. So we're talking about, okay, no chocolates and wines. Well, if you're susceptible to them, but what I mentioned accent, the seasoning accent. My mom used to cook a lot with as a child, and also artificial sweeteners. But what is it about accent first?
Well, the herbs and spices that are natural, especially if they're grown, by the person at home are going to be much healthier, and that individual spices and herbs are probably safer. When you start packaging things together, they have to add preservatives to it. So when you're opening something that you're going to use to make a particular sauce, or you're going to enhance the flavor of your meal, invariably it's going to have various preservatives mixed in, which the most common one is monosodium glutamate, which was probably the culprit in Accent. And a lot of prepackaged foods also have monosodium glutamate. A lot of Chinese food and Asian foods use monosodium glutamate as an enhancer. So that's probably what the problem was with Accent and a number of prepackaged.
Yeah, let's get into that, because we're talking about foods at the grocery store, preservatives. What are some common types?
Well, the preservatives that are in lunch meats and sausage and pork products, bacon, unfortunately a lot of the good tasty things, the nitrates and nitrites that are in those foods can produce a headache in a susceptible patient. But today you can get nitrate-free products, and with refrigerators and monitoring the age of your food from when you bought it with your expiration dates, I think it is very safe to use a natural preservative-free foods in the house that are much less likely to trigger headaches. So nitrates in lunch meat and in pork products, of course the sulfites that are in wine, tannins in a number of things, but chocolate has hundreds of chemicals in it. So eating a healthy, natural diet is probably the safest thing for most migraine sufferers.
So let's go back to the nitrates real quick. I have a fish tank at home, a decorative fish tank, and one of the things that you need to closely monitor for the environment in a fish tank is our nitrate levels. Escalated nitrates will wipe out your fish community. I mean, it'll kill your fish. These are the same types of nitrates that are in the food that we eat, correct?
I would think so. Of course, I'm not a veterinarian, so I don't know if fish get migraine, but obviously all those things can be toxic if not in the proper level.
Right.
So,
Chris, were you going to say something?
Yeah, I was going to say that's the one thing that you have to remember is that you're actively changing the pH level whenever you start adding nitrates. Those are salts, stuff like that. So once you start changing the pH level, even the pH level of your blood makes a difference as to what ailments you end up getting. There have been studies that have shown that different pH levels attribute to different cancers and stuff like that. I personally noticed all of that, like I said in the last episode I was on, I started having anxiety attacks and things like that a few years ago. And I noticed that my headaches went up, especially my migraine headaches. I would have them occasionally whenever I would work rock and roll shows, things like that, just being around a high decibel environment for a long time. And I always wore hearing protection, but
you mean you got headaches from these rock and roll environments?
Oh yeah, absolutely. And I was going to say one of the things that you have to remember is sound is a pressure wave. So the more you're around that intense dB level, it is actively changing the pressure inside of your head. Same thing as whenever you experienced your headache getting worse once you were on the roller coaster. You're talking about G-forces there. You're talking about your blood being pulled away from your brain to being pushed to your brain, depending on which way you're inverted in the roller coaster. I mean, it's a common problem that fighter pilots have, which is why they wear the pressurized suits, is to help regulate the amount of blood flow to their brain. Whenever you're talking about diet, stuff like that, I made a change a long time ago of getting away from sodas, getting away from prepackaged foods. I mean, literally, I've showed my family more than once, look, it takes just as long for me to make pasta from Velveeta and cheese, from cheese, milk, and pasta than it does out of the box.
I agree.
It takes the exact same amount of time for you to melt cheese into milk and make cheese sauce and put it on pasta. So why do we use prepackaged stuff when we're being told that, it saves us time and everything else? It really doesn't. It's It's really just a slight money saver, but I've noticed a huge difference in myself and in how many headaches and the regularity and severity of headaches I get. And it was something that whenever I started on my anxiety meds, my doctor told me specifically, start watching your diet. Start watching what you eat, how much you eat of it. Start kind of charting that and seeing if anything was there.
And that's one thing that we started talking.
Fact of, I drank a lot of sodas every day, stuff like that. And once I moved away from those things like high fructose corn syrup, stuff that we already know causes these issues,
Yeah. And that's one thing we talked about over the break is really keeping, thanks Chris, keeping track of the types of things that you see in foods that could be potential triggers.
I agree, Chris. Rusty, the more natural the diet for everyone, the better. But specifically in relating to people with underlying medical illnesses, or as we're talking about today, headache, we can prescribe lots of different medications, and people can get caught where they're taking medicines all the time. But often people will come back and say, "Oh, I finally listened. I finally read the books. I finally adjusted my diet." And just did some of the things that are on the foundation of treatment for our overall well-being and health will make a significant impact. And people often want it overnight. They want to, you want to be better now, and that's kind of our culture, unfortunately. But it takes some work. A patient's got to be involved in their care and changing the diet and increasing exercise and increasing hydration and staying away from things that are artificial, specifically artificial sweeteners. But also, high fructose corn syrup probably, as is going to be the big articles coming out in the next few months, is probably the devil right now. And this argument that it was all about fat, I think made us all fat. And it's sugar that is probably the problem. And you're also right, Chris, talking about pH. There's a lot of discussion about that in terms of managing people's health and well-being. That the foods that they eat and the beverages that they choose alter the body's pH, and that can lead to increased illness.
And one of the things you were saying, I'm sorry, real quick. One of the things you're saying, these are like some of the best tasting things that are out there. So it's really difficult to make a shift like that.
The best tasting things because we load so much sugar in everything. Right. I mean, I remember when I moved to Texas 30 years ago, people would always tell me about the secret recipe. And I always wanted to know, what is the secret recipe? What is the secret? And, of course, we'll finally find out that Grandma put 2 cups of sugar in the iced tea, and that's why it tasted so good.
Or a bunch of butter.
Right.
Yeah, well, butter and sugar.
It's really funny that you mentioned that, because I'm sitting here drinking some sweet tea as we talk. But it is something that, as someone who worked in the bar industry for so long, people forget to hydrate. They forget that your body can live for like 2 weeks without food, but without water, you're going to die in a couple of days.
Yeah.
And the balance, and I think that's part of the problem, Doctor, is the fact that we in this society have such a concept of an ingrained concept of excess. It's not necessarily a choice of excess. Like you don't have a choice if you go out to TGI Fridays as to the size of plate that they put down in front of you, and we're unfortunately told you have to eat everything on your plate. We're also told we're supposed to consume all these things all the time. People forget that for every cup of coffee you have, you should have a cup of water. For every beer that you have at dinner, you should have an equivalent amount of water going into your system. Otherwise, you're going to get a hangover. Like that's just inevitable. Alcohol dehydrates your system at a rampant rate. And once you start putting a beer, on top of a shot, on top of a glass of wine, what have you, you're talking about an escalating amount of dehydration, which leads to these things. And we really forget that concept of balance, not just in our diet, but in our lives in general, when it comes to stressors, when it comes to things. Like I've had to personally make time to just say, nope, I am watching TV with my 2-month-old son. That's what I'm doing today. I'm not doing work. I literally have to take a break. And we don't have that concept in this society too much.
Yeah, I think you mentioned something about a particular restaurant and the portions. I encourage patients to ask for a to-go box right away and get half the food into the to-go box before they even start eating. Otherwise, we were conditioned that you're supposed to eat everything on your plate. The problem was everything on your plate wasn't the way a plate looks today. I mean, if you think back to the old TV dinners of the 1950s and 1960s, you basically got a palm-size portion of meat and vegetable and the potatoes, and that was a typical meal, and seconds were a luxury often. Now, the plate is filled with food, and that amount of food all at once can be detrimental to your overall health, and especially, again, talking about headache patients, a high carbohydrate meal might be a trigger for a particular patient, or excess sugar might be a trigger. So it can be so variable what brings on an event that you have to figure out what to do for yourself.
And practice kind of being awareness, the awareness of what you're consuming and what could be a potential trigger. Because in the end, I think that there are just so many variables. And it's different. The chemistry, the chemical makeup in every individual is so different that, one person might be able to have a certain type of food and not have the same effects as somebody else. So, like you were saying earlier, and it does take just tracking these things and making sure that we're good. We're going to take a quick break, and when we come back, we're going to talk about a few more migraine statistics, and we'll be back after these messages.
The hour goes...
Hi, this is Rodney Anderson. Many home buyers are finding they have to move quickly in today's real estate market. This is our specialty. We can get you pre-approved quickly. We close our loans in 8 to 15 days, and we close our loans on time. I've been doing loans in the DFW area for over 22 years, and we have put together a streamlined process where everything is done in one building, on one floor, in one office, and our customers keep coming back time and time again. If you're in the market to buy a home and need a fantastic lender, I invite you to pick up the phone and call my office at 1-800-EXPRESS. Our office hours are Monday through Friday, 7:30 a.m. to 7 p.m., and Saturday from 8 a.m. to 1 p.m. You can call us right now, 1-800-EXPRESS, or visit us online at rodneyanderson.com.
Supreme Lending is an equal housing lender. NMLS ID 2129, MLO 196730, 4975 Preston Park Boulevard, Suite 800, Plano, Texas 75093. Texas SML Mortgage Banker Registration. Residential mortgage loan originator.
Finding great people to hire can be like, well, trying to find a needle in a haystack. It's time to try ZipRecruiter, where 80% of jobs get a qualified candidate in just one day. How? Using powerful technology, ZipRecruiter matches your job to the right candidates fast. So, while other companies might deliver a lot of hay, only ZipRecruiter finds you the needle in the haystack.
And right now, you can try ZipRecruiter free. Just go to ZipRecruiter.com/free for your free trial. ZipRecruiter.com/free.
There are two things every parent wants when their child goes to college: for their child to do well and a way to afford it. Now, with Discover Student Loans, parents can have the best of both worlds. Not only do our loans cover up to 100% of school-certified costs with zero fees, but we'll give them a cash reward for each new student loan if they earn at least a 3.0 GPA or equivalent. That means every A in history or B in math could help them earn a cash reward for good grades. Just one of the many ways we treat you like you'd treat you. Apply now in 15 minutes or less at discoverstudentloans.com. Limitations apply.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello and welcome back to the show. We're on our last segment, and if you're just joining us, we're discussing headaches, migraine headaches. First, we defined what a headache was, discussed migraine headaches, and then treatments. We're with Steve Herzog. He's the medical director of the Comprehensive Headache Institute at Texas Neurology in Dallas, Texas. And Doc, what I want to do is I want to call out a few of these statistics and see if we can maybe get a dialogue going. It says here, this is according to the Mayo Clinic, 91% miss work and can't function normally during migraine attacks. More than 70% have a family history of migraines, and 70% of these individuals also have relationship troubles. So when a person is in pain, they can't work very well, they can't provide, and they can't function. And then also it has an effect on relationships. There's a psychological component here that I see with patients who suffer migraines, and it's practical, because when you think about somebody who is uncomfortable and they're in pain, well, they're not going to be the most pleasant to be around. You see a lot of people that are kind of struggling with this a little bit.
Absolutely. The World Health Organization puts out a statistic that a migraine attack can be equivalent in the 24-hour period of time to the disability associated with being quadriplegic, which is an amazing concept. Now, that's not to compare someone who has quadriplegia to a person with migraine. They're talking about in an isolated day of being bedridden, unable to move, unable to eat, unable to take care of their needs for the day until the attack comes under control. So migraine can be a devastating illness, and the patients are often impacted in terms of their psyche and their well-being. Depression is a common comorbidity. Not to say that everybody with depression has migraines or everybody with migraines has depression, but there's no question that frequent headache attacks can cause depression or trigger depression in the susceptible person, as
Almost
well as
like
anxiety.
Like a learned helplessness, like out of despair. You're trying everything, you're uncomfortable, and you're in pain, and then eventually you just learn that, well, nothing's really going to resolve this, so I'm not going to do anything.
That happens frequently. We see patients that haven't come to the medical provider in years, and we have so many new treatments for headache disorders now that weren't even available 5 and 10 years ago, and patients had given up. They had just felt that nothing was going to help, and they just go to bed and they get an ice pack and they hope for the best, and they'll take maybe over-the-counter medications, as the one caller had mentioned, and don't know that there are newer medications and newer approaches. And we have other treatments other than medications now. We have some new stimulators that are available for headache disorders.
I've seen those, yeah.
And it's pretty exciting what's going on. We have new medications which will be out next year, so there are a lot of things to talk about. In 1 hour, we can't go over all the new things alone.
Well, and I was going to say, specifically as someone with the anxiety that I have, everything else, myself, I find a lot of my migraines are caused by muscular issues, stuff like that, in my trapezius area, going up along the neck to the spinal column. And a lot of times, if I throw a TENS unit or something like that on there to be able to relieve some of that tension, it helps out a lot. And that's not necessarily your most orthodox method of dealing with a headache, but it's something that I've found that the two things correspond to me, that the muscle tightness and the headache are both there. Now, talking about modern medications, things like that, I guess it's not necessarily modern, but it's something that's coming more to light now. Where do you fall in the concept of using cannabinoids, things like that, in the use of or in the treatment of cluster headaches specifically?
Well, of course, cluster headaches are one of the worst of the primary headache disorders in terms of pain. We don't have good research yet in headache patients. I wish we did, and maybe sometime in the future we will, so that I can answer the question scientifically. I mean, the drugs are unfortunately not legal, so it's difficult to make a true recommendation. But I will say that in areas of the country and areas of the world that they are legal, there is evidence coming to light that maybe they are beneficial and maybe safer than some of the things that would be more conventional in modern American medicine now. So I wish I could tell you a scientific answer to the question of when and what and how much and what product and how to take it. I can't yet, but I think that there is research going on, and hopefully we'll know the answer to that question. But there's some evidence that maybe those things could be helpful in the future.
You mentioned some assistive technology coming out. What are some of those that you've heard of?
Well, as Chris mentioned, a TENS unit in his neck. There are now, or neck and shoulders for muscle spasm. There's now a TENS, what would be considered a TENS unit called the Cephally device that's worn actually on the forehead. It looks a little like something that someone on Star Trek would have. There's a little sticky pad that goes right over the brow, and the device then has a magnet in it, and the sticky pad also has a magnet. Put the device on for 20 minutes every day, and as a preventative. And after a month or two, a patient may find that they have a reduction in frequency and severity of headaches by approximately 50%. It probably only works in about 50% of the patients, but actually the oral preventatives that are taken daily only work in about 50% of the patients. That's one of the devices, electrical stimulation. There's also a magnetic stimulator called the eNeura device, and the eNeura device gives you a magnetic impulse superficially across the scalp, and you put it on the back of your head, and you give yourself 4 impulses in the morning and 4 impulses in the evening. Problem, of course, is right now these 2 particular devices, which are FDA approved for headache management, aren't covered by insurance, and so it's a financial challenge. But I think in the future they probably will be covered, and we'll see them as a good add-on therapy to the foundation, which is always the natural approach, and then the secondary approach would be potentially oral medications. And it may be, Rusty, that these devices will actually become primary and medications would become secondary. That would be nice if that happened in the future.
Yeah, well, I know as technology becomes more evolved, we're seeing some really incredible things. And like you mentioned, a keyword with me, that magnetic stimulation. Now, you're seeing a lot of these transmagnetic stimulation places kind of opening up. I mean, it seems like the horizon's pretty broad.
I think it is, and of course, magnetic stimulation is used in depression and anxiety, a number of other disorders. And recall we talked about earlier that migraine is a neurochemical neurotransmitter disorder. Fundamentally, that's the cause of the underlying headache disorder that makes a person triggerable. But depression is a chemical and a neurotransmitter disorder. So is anxiety in some cases. And I think that the horizon for these stimulators is pretty open here. It'll be interesting to see what happens in the next 5 to 10 years.
Yeah. And even in my field, you're starting to see a lot of this with biofeedback. You're seeing Apple Watches that can now take your heart rate variability, and then there are also other assistive components apps like on an iPhone that have devices that you can plug in. So, in fact, somebody showed me one the other day where you can actually your iPhone uses the flashlight as a photoplethysmograph, and it actually reads blood volume in your thumb.
Wow, these are new things.
These are really new things and really crazy. And I'm not. And I told her I'd check it out to look at the reliability, because a lot of it's not clinical, but it's still kind of it's a pretty marvelous attempt to kind of to make an adjustment like that. So.
Yeah, well, as we see, pretty much everything we saw in Star Trek as kids is coming to light, except for maybe transporting people. Teleporting. But that teleporting might even come into being. But a lot of monitoring devices through our iPhones and various smartphones are incredible, and being able to monitor your health in real time is important. And there are also apps for, as we talked about earlier, the calendars that you can monitor, when and where you're having the event, what you did that day that might have triggered it, whether it's, you hurt your neck, or you overdid it at work, or you had too much stress, or you didn't sleep well. All of those things can be monitored, and then you can look at your calendar to help determine, your particular triggering factor and when you're most vulnerable, like for women during their cycle, or during the week at work, or when you're not on vacation.
Yeah, even with the approach in biofeedback that we see, we work a lot with neurologists. Of course, we work with your practice for several years now, and being able to kind of help address and help patients be able to monitor and control their stress and anxiety level. It's a conversation we had at the beginning of the show off air that a lot of times, we work with physicians that will help to balance that stress and anxiety. It's not a replacement for medications, but it's a part of the program where I think that, stress levels can also certainly have a pretty substantial impact on your symptoms and make it worse.
I think it's important for people to understand that when we talk about the medical team, we're not talking about just the doctor and the nurse practitioner, or the physician's assistant, the nurse, the medical assistant. We're talking about the patient. The patient is number one on the team, and they've got to be involved in their care, and they've got to be invested in getting better, or they often don't. And it's frustrating for patients when, they get a prescription and they're told, this is how you're going to take, this is, how often to take it, and they're not educated into how they can make themselves better. And so I think it's important for a patient to be involved in the care and understand why and what they're doing, and want to take some control.
Real quick. real quick, tell me, how can people find you, Steve?
To come see us at the Comprehensive Headache Institute at Texas Neurology, they can look it up on the web at texasneurology.com, or they can call the office, which is 214-827-3610.
Excellent. And you have a website, yes?
We do have the website.
What's your website?
texasneurology.com.
texasneurology.com. And Chris Jordan, little plug for you.
Oh, sure, yeah. You can check me out Tuesday nights on the Dudes and Beer podcast. You can either download our free app on the Android or iTunes Marketplace, or you can visit dudesandbeer.com/listen-live.
Very good. Well, we're wrapping up the show on headaches. I really appreciate you coming in, Steve. It's great to see you, and always good to kind of get an update on how things are going at your place. And, with the addition of a new doc, it's an awesome guy.
Yes, and we're very happy to have Dr. Corey, who's our pediatric and adolescent headache specialist.
Yeah, excellent group. So I highly recommend Dr. Herzog. And, folks, when it comes to headaches, it's not always about trying to muscle through it. Really try to get some attention to it and start with your primary care physician, and then maybe look at a specialist like Dr. Herzog and his practice at Texas Neurology. Have a great afternoon, and thank you for being with us on the Therapy Hour.